everyone, so let's move towards our today's topic, which is let's move towards the topic that is thyroid gland. Okay, now we will discuss in this lecture about what is thyroid gland and what are the structures and what is the blood supply and so on. Now, first of all, you need to understand that the basic of the thyroid gland, that what is basically thyroid gland. So thyroid gland is an H-shaped gland, a structure which is present in the anterior region of the neck, and it is endocrine gland. Okay, there are two types of glands in our body, exocrine and endocrine. And the thyroid gland, if I talk about thyroid gland, so thyroid gland is an endocrine gland and it is present in the anterior region of the neck. In the anterior region of the neck, trachea is present, and behind trachea, esophagus is present. Okay, now anterior to the trachea, in front of trachea, thyroid gland will be located. Okay, and in other words, it is present at the level of C5 till T1 vertebrae. Okay, from the cervical vertebrae 5 till the thoracic vertebrae 1, this gland will be present. And if I talk further about this gland, the interesting thing is that it consists of two lobes. Okay, right lobe and left lobe. That lobes are present on the side of the neck. They are moving laterally. Okay, so they are present on the side of the, not side of the neck, it is present on the side of the trachea. Okay, they are covering the trachea basically, on the side of the trachea, and they are connected, these two lobes are connected anteriorly by isthmus. Okay, so you have to remember this point, which is very much important. Now, if I talk about the function of the thyroid gland, so thyroid gland will secrete hormones. Okay, it will control the metabolic rate, it will control the calcium metabolism as well. Now, moving further, another extra lobe will be present and could be present in some individuals, that is called as pyramidal lobe. And if it is present, it will be present, it will arise from the upper border of the isthmus, and it will present till the hyoid bone. Okay, so remember this point as well. Now, if we talk about the size, so this thyroid gland is larger in female than in males, and in females, when it is menstruation or pregnancy period, so during that phase the thyroid gland will further increases. Okay, so this is very much important question regarding viva and exams, so remember this point. Now we will talk about lobes of thyroid gland. Like I said, there are two lobes, right lobe and left lobe, and those lobes are conical in shape. Now the upper corner like portion of cone-like structure, cone-like part of the lobe is called as apex of the lobe of the thyroid gland, and the inferior part is called as the base of the thyroid gland. Okay, base of the thyroid gland is present at the level of fourth tracheal ring. Now, what is tracheal ring? In this topic, you have to know that what is tracheal ring. Basically, tracheal ring hoti kya hai? Inside the trachea, as we have discussed earlier in many topics as well, that inside the trachea there are C-shaped cartilages which prevents the trachea from collapsing during exhalation and inhalation. So what happened, those C-shaped cartilages are also called as tracheal rings, and there are total 20 tracheal rings inside the trachea. So the base of the thyroid gland is at the level of fourth tracheal ring. Okay, and in some books it is written as fifth tracheal ring as well. Now, moving more further, the surfaces and the border. There are three surfaces and two borders, anterior border and posterior border. And if I talk about surfaces, so there are three surfaces, like I said, medial surface, lateral surface and posterior surface. Okay, now the lateral surface consists of a carotid sheet. Okay, you have to remember that what are the contents of carotid sheet. So as the name indicate, the carotid sheet will consist of common carotid artery as well as vagus nerve and internal jugular vein. So those contents are present in the carotid sheet, and carotid sheet is present on the near the lateral surface of the thyroid gland. Now if I talk about medial surface, so medial surface is connected, is attached with the basically it is attached with the esophagus and trachea. As you know that thyroid gland, the lobes of thyroid gland are present on the side of the trachea, so basically they are covering the trachea. This gland is covering the trachea, so you will easily memorize it that the medial surface of the trachea is basically connected with the esophagus and trachea. Now if I talk about postolaterally, so postolaterally, not postolaterally, posterior surface. Okay, there are three surfaces: lateral surface, medial surface and posterior surface. That posterior surface is also called as postomedial surface. Okay, postolateral surface. So postolateral surface consists of carotid sheet and some arteries and veins, which is not much important. Okay, now if I talk about anterior of the thyroid gland, what happened, the muscles are passing. As you know that from the sternum is connected, from sternum a muscle is connected, that is called as sternothyroid bone and sternohyoid bone. Okay, from sternum it is that muscle is connecting the sternum to the hyoid bone to the thyroid cartilage. So those muscles are passing anteriorly from the above side of the thyroid gland. So basically the thyroid gland, in other words you can also say that thyroid gland is present deep to the sternothyroid and sternohyoid muscle. Okay, now which is another point which is very, very much important, the blood supply. The blood supply of thyroid gland is through superior and inferior thyroid arteries. Okay, superior and inferior thyroid artery. Superior thyroid artery is basically the branch of external carotid artery, and the inferior thyroid artery is basically the branch of the thyrocervical trunk, and thyrocervical trunk is arise from the subclavian artery. Okay, now if I talk about superior thyroid artery, superior thyroid artery will be divided into two branches, further branches at the gland, and that branches are anterior branch and posterior branch. Anterior branch will form an anastomose with another anterior branch. As you know that obviously there are two lobes, so obviously from the right external carotid artery and from the left external carotid artery, from both the external carotid arteries, superior thyroid artery will arise on the right side as well as on the left side. So the anterior branch will be on the right side as well as on the left side. So both the anterior branch of the superior thyroid arteries will form a anastomose, and the posterior branch will be connected to the inferior thyroid artery, which I told you that which is the branch of the thyrocervical trunk. Okay, now venous supply, venous drainage. Now venous drainage is through superior thyroid vein, middle thyroid vein and inferior thyroid vein. Okay, the superior thyroid vein and the middle thyroid vein basically drains into internal jugular vein, and if I talk about inferior thyroid vein, so it will be drained into brachiocephalic vein. Okay, so remember the most important point, which is very much important. Okay, venous supply is through superior, inferior and middle thyroid vein, and the arterial supply is through superior and inferior thyroid artery. Now moving towards the nerve supply. The nerve supply of thyroid gland is through superior, middle and inferior cervical ganglia. I have told you a lot of times that what is ganglia and how it is formed in the cervical region. So collectively they form collectively the nerve will form a ganglia, and that ganglia is basically the upper ganglia is called superior cervical ganglia, in the middle region middle cervical ganglia, and then the lower region of the cervical vertebrae area the inferior cervical ganglia will be present. So those cervical ganglia will supply to the thyroid gland, which is very very important. So this was the whole topic. And one more point, clinical point of view, that when there is a surgery of the thyroid gland, you have to be very careful regarding the recurrent laryngeal nerves which are passing between the trachea and the esophagus, because if it is damaged, obviously nerves are damaged नहीं होनी चाहिए, तो nerve damage हो सकती है, क्योंकि thyroid gland के बिल्कुल साथ ही those laryngeal nerves are passing and those recurrent nerves are passing. So this was the important point, and this was the whole topic regarding thyroid cartilage. Till then, work hard, study hard, and good luck. Bye bye. Thank you. Allah Hafiz.